Hello, Kemanachan. I'm Dr. P. Venkat, surgical oncologist, Apollo Cancer Center, Chennai, India. Again, there's another important type of cancer called colonic or rectal cancer. So again, this cancer is also very common type of cancer. Generally among all the cancers, around 5 to 7% of the cancers are colorectal cancers. Again, these cancers are also cancers which can be where the cure percentage is very high, and these cancers can also be picked up very early. There's a lot of advancements in these cancers. Again, the commonest causes of these cancer, again the same thing, unhealthy lifestyle, eating a lot of red meat and not doing exercises. And these cancers are also got a genetic predisposition where around 5 to 10% of these colorectal cancers also occurs because of genetics and things. Again, all of us, any male or female above the age of 50 should undergo at least once in 2 years a colonoscopy. Once you undergo a colonoscopy, a colonic cancer doesn't just occur instantly. Again, it usually occurs starts as a small polyps. These polyps undergo a lot of changes, and the last change will be what is called a tubulovillous adenoma. After a tubulovillous adenoma only changes into a cancer. So if you do a regular colonoscopy, you can pick up these before the development of cancers at the stage of a polyp itself. You can pick it up. Once you remove the polyp, the patients don't develop a cancer and things like that. From a normal polyp to developing a full-blown cancer, it approximately takes around 2 years of time. So once you pick it up early, it will be a better way of doing and things like that. Again, colonic cancer, the most important treatment is going to be again surgery. Again, colon we divide into three major. The right side colon, it's called ascending colon, then the transverse colon, then what's called a descending colon. The main modality of treatment is going to be only a surgery. And for all these surgeries, earlier we used to make a long incision around 20-25 centimeters and things like that. Nowadays we use a minimally invasive surgery where we can do a robotic surgery and remove these cancers completely, and we can save the remaining rest of the colon and things like that. And usually these cases have become like a daycare surgeries. The patients can come, get operated, the very next day we discharge the patients. So the outcomes are also very good. Again, coming to rectal cancers, and sometimes after this colonic cancer treatment, they will also require whenever the patient is in this stage, they will require chemotherapy. Another is the rectal cancer patients. Rectal cancer rectum is nothing but the lowermost part where we pass motion. That's only called rectum. See, early days, whenever the rectal cancers, most of the times the patients will be thinking that you need to remove the entire rectum and keep the motion passage in the side. It's going to be permanent. Nowadays, we don't do that at all. See, there's a lot of advancements in the treatment where we go all out and try to keep the motion in the normal passage. And again, rectal cancers, 95% of rectal cancer patients will require surgery, chemo, radiation, but usually surgery will be the last option. Usually it will be starting off with chemo first, then radiation, last is going to be surgery, and we make all efforts to try and preserve the motion passage. Almost around 95% of rectal cancer patients do not require removal of the rectum. So again, the outcomes are very good and they do extremely well, and the quality of life is also very good. So again, rectal cancer, there's nothing to worry. You can preserve the rectum, the percentage of cure are very high, and the treatments are very advanced, and it's like the straightforward, it's more of surgery, is also daycare surgery, and we do it as a robotic.